35 and 35. But it's just as much the man's fault as it is the woman's fault as far as infertility.
It's not fault.
Huh?
It's not fault. It's abnormal. It's not fault.
Yeah, well, they could have weak sperm. They can't swim.
Yeah. I mean, it's the word fault. It's not fault.
Yeah. The reasoning for it is 50-50.
Yeah.
Okay? The reason for it is 50-50. I think in this book it says 35 and 35. Okay. But first off, let's talk about, let me see what the next slide is. Okay. So, subserosal, intramural, submucosal. Dylan, tell me what those are.
The 3 layer of the subserosum.
No, it's not the 3 layers.
The teratoma.
No.
That's the fibroids.
These are the fibroids.
The names of the
Subserosal. It deforms the perimetrium or the serosa of the uterus. So our uterus is not nice and it's going to have like a little hump sometimes. Okay? Intramural. It's in the myometrium. I have a fibroid in the myometrium. Submucosal. It deforms my endometrium. Okay? Submucosal fibroids cause dysfunctional uterine bleeding. We annotate that by DUB. A fibroid. It can be any echo texture. It's usually heterogeneous. It can lose its blood supply and start necrosing or dying. And it can get kind of cystic structures in it. Or it can calcify. Okay, so you have all of those echogenicities that you can think. A septate uterus. A septate uterus almost looks the same as a didelphys uterus. Okay, it's going to have 2 uterine horns. A lot of times it depends on how far the septation goes. If it's just the shape of a heart at the fundus, we call that an arcuate. If it goes further down, we call that a septate. If it goes all the way down to the cervix, we call that a didelphys. Okay? Now, if an embryo or a conceptus at this time implants on the septation, there's no blood supply. There's none. Okay, so the baby is going to implant. You're going to have a positive pregnancy test because it's the blastocyst that puts out the hormones to tell our body that we're pregnant. But you're going to lose it because there's no blood supply. Okay, so a septate uterus also is a cause for infertility. Endometrial polyps. We have polyps in our gallbladder. We have polyps in our endometrium. It also can cause dysfunctional uterine bleeding. Okay? It's something foreign inside. It's just epithelial cells that have proliferated, and now I have like a skin tag inside my endometrium. Okay? They always take those out. They want to because they could be precancerous. Okay? They want to keep a check on that. But because the blastocyst is trying to implant into the endometrium, if it lands close to a polyp, you're going to lose the baby. Okay? So, Asherman syndrome. Oh my gosh, now we've heard that before, right? Okay? What is it? It's known by 3 names. Adhesions, Asherman syndrome, Synechia. Synechia. Synekia. Huh? I'm sorry, I can't hear you. Uterine adhesions. Okay. So I've had 6 abortions. Okay. Well, every time I have an abortion, I'm going to build up more scar tissue. Okay. And there are women out there that use abortions as a form of birth control. Okay? Tubes. Hydrosalpinx. What is it, Wynn?
Fluid.
Water in the fallopian tube. What is Piosalpinx?
Pus.
Pus in the fallopian tube. Okay? Well, if the canal is not open, the ovum can't get up, the sperm can't get in. Okay? And that happens most of the time at the fallopian tube. Okay? I can also have adhesions in my tube. I've had chronic PID. I'm going to have a chronic hydrosalpinx, and that can build up adhesions. Ovary. I can have endometriosis, which is ectopic endometrial tissue. We can't see endometriosis on ultrasound.
Ultrasound.
How do we make the diagnosis?
MRI.
Yeah, MRI is the imaging modality, but how can we as sonographers make a diagnosis of endometriosis?
In the back on the uterus?
No.
No, we don't do this.
How do we make the
Turn the color
diagnosis?
on.
Endometrioma. That's the only way we can make a chocolate cyst. That's the only way that we can make a diagnosis. But in that endometrioma, we have to find the echogenic foci. This is a homogeneous mass, and then you're going to have an echogenic foci. All endometriomas are homogeneous with the echogenic foci.
One.
You have to find it. Superior, inferior, lateral to medial.
Is that measured?
No. PCOS. What does that stand for, Myra? PCOS.
Polycystic ovarian.
Polycystic ovarian syndrome.
PCOS.
Okay. I have a ring of pearls. Yes, you wanted to ask a question?
Yeah, it says in the endometrium is most common type of the ovarian cyst found at surgery. So they only found this in the endometrium when they're doing the surgery?
No, we can see it on
On
ultrasound.
the arm, okay.
Maybe, but.
But we can only suggest. Okay? We can only suggest. It's not until pathology comes in and does a cytology exam on it that the diagnosis can be made. Does that make sense? That's what that sentence does. Because we can only suggest what it is. Okay?
We should suggest or just describe.
We don't say anything. We just say a homogeneous adnexal mass, echogenic foci, and we're done.
How can we differentiate the chocolate cyst from the PCOS cyst?
Oh, big time. Okay, this is gonna be big. It's gonna be homogeneous. PCOS. I'm gonna have anechoic structures around the periphery of my ovary. Usually though, Patricia, they're going to be more round because they're really kind of almond shaped. But they're gonna be more round with PCOS. And the measurement's gonna be greater than 3.5 because an ovary shouldn't measure greater than 3.5. Okay? PCOS. It's a hyperandrogen. too many male hormones. I don't have that LH spike. So my body doesn't know to get rid of a follicle. Okay? Now, what is a mature follicle called? Graphian follicle. After it spits out the oocyte, what's it called?
Corpus luteum.
A corpus luteum. Now, it still puts out some estrogen, but mostly it's going to be putting out progesterone. Okay, so here's the hormones. Let's go over the chart one more time. Okay. The follicular phase. What days?
First 13.
1 through 14. Luteal phase. 14 to 28. What is this spike right here? Huh?
14.
Yeah, but what is it a spike of? LH. Okay? So my follicular phase, it's telling my ovaries to build more follicles with FSH, follicular stimulating hormone. Day 14, there's a spike of LH that tells the ovary spit out the ova, the mature ova. This closes back up. Now it's called a corpus luteum. And the LH and the estrogen are leveling out. Yes?
This only happens in one ovary at a time, right?
That's what they think. Okay? So, what does estrogen do? It gets the endometrium thicker. Here's menses. My estrogen is building. My endometrium is building. LH, my estrogen starts declining. My progesterone starts climbing along with my estrogen, because now I'm in what phase? Proliferative phase the first 14 days. The last 14 days, I'm in the secretory phase.
Secretory.
The endometrium is thin because I'm bleeding. It's getting the 3-line sign at ovulation. It's getting really thick and fluffy in the secretory phase. Any questions? Good? Okay. These are hormones. This is ovary. This is hormones. This is endometrium. Okay. I'm in my cycle. It's a thin line. I'm close to ovulation. I have a 3-line sign. I'm close to my period. I'm in the secretory phase. I have a thick adenomous endometrium. Okay. So, here's a follicular cyst. It holds an ova or an oocyte. They're exactly the same. It's growing. It's growing. It's growing. It's growing.
Let's go.
It spits it out, corpus luteum, and it decreases.
So it's just
Okay.
a cycle. It's
Every month
ends.
it cycles. Or they say, some people say they think it's every other month. That this side does it this month and this side does it this month. If you have middle schmerz, which is painful ovulation, then you know which side. And some women are very in tune to their bodies. They know exactly when they ovulate. Okay?
Yeah.
Yes.
Can we predict which one will be the right side or left side if we see it at the ultrasound? When we scan the lady, can we see which one is ready to ovulate?
Yes, because this right here is called the cumulus oophrus, and we can see that in a Graphian follicle. we can see that in a Graafian follicle. Okay? We're not gonna go over